HPI, you're collecting one problem, and then that one problem is problem number one. On your problem list, problem number one is always the chief complaint. Is that clear, guys?
Yeah.
Only one problem out of HPI, and then the problem number one on the problem list, who is it?
Chief complaint.
The chief complaint. Is that clear? All right. So, and in the HPI, you're asking more questions, but it's all related to problem number one. So you don't generate problem number two, number three, number four. No, it's only problem number one. Is that clear, guys? Is this clear? Okay. All right. So now we put like problem number one. We're done with the HPI. We did the past medical history, and then so also we did the family history. Then like we're coming to psychosocial history. Under psychosocial history, what do we have? We have nutrition, we have travel, we have smoking, we have alcohol, we have money, we have relationship, right? All this in the psychosocial, all right? So now you're asking questions, all right? So now you're in the nutrition, what are you asking? You're doing 24-hour diet recall. What did you eat yesterday for dinner? What did you eat like today for lunch? And then what are you gonna be eating? What did you eat for breakfast? So I put that there in my sample. That's not in the book, that's extra. The only reason I know this because I'm diabetes educator. Okay, so now you have to suffer. All right, so because I have to teach you, because if I know something, I have to teach you, right? So, okay, so that's how it goes. So now like that 24-hour diet recall, that's what I do for my patients too, because I have to understand like what is the culture, right? What are they eating, right? So you do like the diet recall, and at the end of the diet recall, so like you have to break it and say that this is how many calories this patient takes, and then this is how much carbs, proteins, and then good fats they're taking. What is the recommendation? I put it in the paper. Recommendation is that 60% of the food comes from carbs, 20 from protein, and 20 from fats. All right, so if this person is on keto diet, so like what is their fat and protein there is going to be higher, the carb is low, right? So now like you're going to be saying, okay, so at the end, what you're going to be saying is that you're going to be saying, what are you going to be saying? Okay, so now this is the psychosocial. Let's say this is psychosocial. All right, and then, so here the nutrition is the first one, nutrition. So you took the diet history, and then so that you found out that this patient is only eating 30% carb. Okay, so let's say 50%, let's say 40% protein, and then 30% fat, all right? So this is a keto diet, right? Okay, so now, what is the recommendation? I put it in the paper.
60%
60,
carb.
20, 20. So what are you going to be writing? Unbalanced nutrition, right? Because it's unbalanced. All right, so now, because you found out that it's unbalanced, so where does that go? On the problem list. Do you see? The problem list is populated as you're gathering the history. Are you with me now? So now like here, what are you going to write? Health maintenance, nutrition. Okay, so what was that? What is it? 20% or
30% carb.
30%?
40%.
Oh, you don't have to write this. What are you gonna write? You're gonna write, okay,
Imbalance.
carb, like less of carb, excess protein, excess fat. Do you see? This is how you're gonna be writing it. Are you with me? So what did you find? What was the problem?
Imbalance.
Health maintenance, nutrition, reduced carb, okay, excess protein and excess fat. Are you with me? That's the problem. Now, because that's a problem, then you're going to be putting a plan to help the patient. Is this clear? Are you getting it now?
Mm-hmm.
So in the psychosocial history also, so the psychosocial history, there is alcohol, for example, right? So like if the patient is drinking like 6-pack every day, or like 1 bottle of whiskey every day, so that's a problem. All right, so then what are you going to write? So health maintenance, alcohol consumption, excess. Are you with me now? So because like one of the students was telling me last time, oh, we're all healthy, like we don't have any problem. There is a lot of problem, health maintenance. Does that make sense? Like none of us are perfect, right? So exercise can be deficient, right? So like then you're gonna be writing about exercise. So anything in the psychosocial, what is it? It's health maintenance. Is this clear, guys?
For food intake is normal, we write balanced diet or nutrition.
Yeah,
and
then it's not a
balanced diet.
problem. That you don't put it on the problem.
Oh,
If
it's not
you
a
find a
problem.
patient, if you find a patient that she's eating 60% carb and then 20% protein and then 20% fat and then they're following the recommendation, then that's not a problem. So you don't put the health maintenance anymore, nutrition. Does that make sense? Are you with me, guys? So if it's not problem, then it's not on the problem list. Are you with me?
So in nursing diagnosis will always be number one on the problem list?
Right, because that's what I'm requiring.
Okay.
And then so the other nursing diagnosis is psychosocial, like mental health. Because I want you to take care of the mental health of the patient too, because we have a holistic approach. Does that make sense? Okay. Sakya, the second problem that you're gonna be doing a plan on it, it's gonna be mental health.
Okay.
Mental health. Because like I want you to address the person holistically. Alright, so in other words, then there is relationship in the psychosocial, right? So married for 30 years does not feel appreciated and loved in a relationship. Like there are a lot of women, they're in a marriage and they're not being appreciated, right? So that's a problem. Alright, so that's a problem. So like what are you gonna be writing? Health maintenance, so relationship unappreciated. So that's a mental health. That's another problem that you're gonna be discussing. Is that clear? Okay, so here, like with you, like most of you, like you're gonna have a stress overload secondary to a school assignment. So then that's a problem, psychosocial problem that you're gonna be discussing because it affects your mental health. Are you with me? So in the plan, you're doing two diagnoses from the problem list. The first one is gonna be the problem number one, which is your chief complaint. Out of here, what are you selecting? The one that is affecting the mental health. All right, so stress overload secondary to what?
School.
Secondary to school assignments. Are you with me? So that's what you're going to be doing it. You're not going to be doing nutrition. I don't care about the nutrition for this paper. Is this clear, guys?
Mm-hmm.
All right. Okay. So. And then also like in the psychosocial, there is exercise, right? So like the patient doesn't exercise because like there is time tightness. You're gonna be finding that. So what are you gonna write here? Health maintenance.
Inadequate exercise.
Okay, very good. Exercise. Inadequate. Okay, so now how do you know it's inadequate? What's the recommendation? According to the diabetes prevention program, so 30 minutes 5 times a week is the recommendation. So that's where that's the science. So I have to use science, right? The DPP, which is the diabetes prevention program, thank you. Diabetes prevention program, what did they find out? They found out that it's how if you're doing 150 minutes moderate exercise, you're deferring inception of diabetes with 10 years. So that became a recommendation. So that's what I'm going to be using. Where did it come, the inadequate? Because this patient is not exercising at all. There is no time. Is that clear, guys? Are you seeing how I'm processing now? All right. So then, you know, there is this patient that, okay, you're a student, a lot of you, okay, money's tight, right? Okay, so like you're not working, the family doesn't have enough money, so like you're worried, right? So again, health maintenance, economics, inadequate. All right, so that's how you're populating your problem list. Okay.
So that was the recommendation of the 30 minutes 5 times a week. That's the diabetes.
Prevention program.
Oh, okay.
Diabetes prevention program. So it's science. You can use it as a reference as long as it's science.
Also, that would go to our reference list.
Yeah.
If we.
Yes,
decide-
bravo. Now like the brain is working. Hey, hallelujah. Okay. Hey, we're making it. So okay, so like we're progressing. Very good. Yeah, because where did I get that science? Diabetes prevention program. You can get any science anywhere, but provided that it's a science. and you put it on your reference. Very good.
So
Okay,
for
good job.
nutrition, it would be like.
ADA,
The-
ADA, like that's where I go, ADA standards.
Yeah.
So because I have a lot of patients and they say, this food, I'm not gonna lose weight on this. Okay, so I said, you know, like I know there are a lot of other diet recommendations, but like my clinic is ADA accredited, certified. I have to follow ADA standards. Does that make sense? Who said that this is the right diet? Like people are challenging me. Like not, it doesn't happen all the time, but like there are some patients that they challenge. Oh, so this is too much carb. Like I'm not gonna be eating this because I'm not gonna follow your recommendation. I said, you know, like you're free to follow any recommendation because like the internet is full of references, but like here in this clinic, I have to follow this ADA curriculum. Otherwise, I'm not gonna be able to be accredited. Does that make sense? Okay, so I think it's making sense now, like little by little, like, right? Okay, very good, good job. So what did you learn from here? That the problem list is populated as you go along. Is that clear?
Mm-hmm.
So, and then so when you go to the review of system, in the review of system, so you're asking the head, all right, so then like you're asking the skin, do you put sun protection, SPF 30 or more? No, I forget, like a lot of us, we forget, right? So then what are you gonna write? Health maintenance, what are you writing here? Health maintenance,
Risk of.
maintenance, skin care. Okay, so lacks
Protection.
protection. Does that make sense? Lacks protection. Do you see how it works? Okay, because in other words, all these problems that you're generating out of this history, you don't have time. Like, so what are you gonna do? You have time for this because they came with it, and then out of this, you're gonna be selecting one problem that is affecting the mental health. Because otherwise, if you don't address it, like I'm gonna go crazy. And you're my nurse, you have to help me. Does that make sense? Because like otherwise, like I don't wanna go crazy. So you need to take care of the mental health of this patient so that they can follow your recommendation here. If I'm gonna go crazy, am I gonna follow your recommendation? No, because I'm too distressed. Do you see now like how you approach holistically? All right, so yes,
So from the review of systems, when we go
one by
step
one.
step, if we see something that's
Not normal, then it goes on the
Okay.
problem list. Does that make sense? So for
Yeah.
that reason, so like if you're gonna be going, then after the skin, so what are we having? The eyes. Okay, so like if I'm wearing glasses, I have to go to the doctor, like every year. If I'm not going to the every year, so there is a problem. Health maintenance, eye care. Last visit 2018. Do you see what I'm saying? So that's how you're gonna be populating it. But that day, what are you gonna take care of? Only this, you don't have time. You're only taking care of this, and then the psychosocial, one psychosocial, you leave the list, because next time when this patient comes and you're off, another provider is taking care of this patient, can take care of these problems. Is that clear? So identification of the problem helps the delivery of care. Do you agree? Do you see now? All right, so, and then, okay, so it's good that you're recording because I don't think others know this either, so. The other thing that I'm gonna be telling, I told 5 problems, but if you find more than 5 problems, you have to list it. 5 is the minimum. All right, so then like you go to the, then you go to the eyes, then you go to the mouth, right? So like they haven't seen a dentist for 3 years. Right? Because like there are a lot of people who have denture. Like my father is one of them. Like he says like I have denture. Like why do I need to go to the dentist? No, you have to go to the dentist because dentist assesses the gums, the mouth care, right? So a lot of people think this. So it's not unusual. You're gonna be seeing this patient. So like then what are you writing? Health maintenance, dental care. Last visit 2018. It has to be annual. Is that clear? In reality, the recommendation is 2 times a year. Right? The recommendation is 2 times a year, every 6 months. All right. So if you have like the last visit is 2018, like it's too overdue. All right. So the other thing that I'm going to bringing it up, and then you say last visit 2021. I saw this like when I was doing papers for the summer session. So like you said, like 2021. So it's okay, like we're 2022. So, but you have to write that, okay, had made appointment with dentist for September 28th, 2022. Then that doesn't become a problem. Does that make sense?
Mm-hmm.
But if there is no appointment, so 2001, already 2002, already we're past 1 year. So is there a plan? If there isn't a plan, then you're gonna be writing health maintenance, dental visit 2021. If the patient says that, oh, I already made an appointment, I'm gonna go October 1st, 2022, you're good. Is that a problem? No, he's gonna go for 2022. Is this clear? So this is very important, students, like put the appointment. If like it is 2021, 2022, you have to put an appointment. If there is no appointment, then it goes on the problem list. Is this clear? Okay, very good. All right, so then after the eye, we did the, let's say the heart, with the heart there is EKG, with the chest there is X-ray, TB, and then you come to the breast. So, and then the woman is like 40 years old, then the recommendation is annual mammogram. So she doesn't have a mammogram yet. All right, so what is it? It's health maintenance. All right, so mammogram, less or no mammogram, age 40. All right, so you're gonna be looking, the recommendation, every time it's changing. I think it was, they brought it back into 40, like it was 40, it became 50. So the colon cancer, it was 50, they brought it down into 40 because a lot of people from 40 to 50, they're having colon cancer and then they don't have colonoscopy. Does that make sense?
Also depends on your family history.
History also, that's true. That's true. Like my daughter-in-law, like her father died of colon cancer, she's 30. She has like how many colonoscopies by now? Alright, so like that's a problem. Like she has to have it done when she's younger, not all the way to when she's 40 because there is family history. Is that clear now?
Mm-hmm.
Okay, so
Let's say skincare.
the skincare, lack protection. Lack. The skincare, lack protection. Lack of protection. Okay, so in other words, there is no sunscreen. Okay, so that's how you're gonna be doing. So, and you have to address, and even if some of you are young, like you're not gonna be having mammogram, you're gonna say no mammogram. You don't leave it blank. Because like people, the other day, I had a patient in my class, 32 years old, she's a cancer survivor, and she's cancer 32. She came like to learn how to eat she didn't have diabetes or anything, so she wanted like to eat more nutritious food so that like she can gain weight.
When is your classes? I think I could use that.
Yeah, for every Tuesday, 4:30 to 6:30. Okay, yeah.
Should there be something listed for every body system?
It's already there.
I mean like for the paper.
It doesn't matter, like it's you have to go. I mean, if you find a problem, you have to list it.
Right.
Okay. So, for example, if you're going to the respiration, and then this patient who has burning with urination has asthma. Okay. So, like you're gonna say that diagnosed with asthma, like she's on inhalers, well controlled. Last asthma attack was 2018. So it's not a problem, but it's not healed either. So what are you going to write? History of asthma, diagnosed with history of asthma, diagnosed 2010, right? Well controlled with inhalers.
So that won't go on the problem.
It will.
Oh, that will go.
Yeah, why? Because it's not resolved.
Oh, okay.
Yeah, she's gonna get asthma doesn't resolve, hypertension doesn't resolve, COPD doesn't resolve, diabetes doesn't resolve. It's problem till you die.
Okay.
Does that make sense?
Yeah, now that makes
Anything that is not gonna be gone, it's gonna be on the problem list. Is that clear?
Yeah, so like if I had
Symptom management
HPV,
not
like
clear.
if I had cervical dysplasia, even though I don't currently, it's still
Have
go
it
on my
there.
problem.
Yeah. And then if there is like, so if there was any problem also, like, fracture, history of fracture of like femur or hip, resolved completely. So still it's gonna go there because if somebody fell and then broke a hip, that's not normal. So there is like a bone problem. It's a problem, it's resolved, but it alerts the provider.
Yeah.
Does that make
But
sense?
like a broken arm when you were 6 years old.
No, it doesn't. Yeah, it
doesn't
doesn't.
need-
Yeah, because it was because of an accident, So, but like things that like you can attribute to weakness of a system, it has to go there. Or even though it's resolved, even though it's under control. Because history of diabetes, well controlled A1C 5.7. Alright,
still write
so
that in.
it's very well controlled, but diabetes is not cured. It's there. So we have to put it there. Are you understanding
Yeah, now I
now?
get it.
Finally,
Yeah.
huh?
Yeah.
Okay, good, good. So in other words, like when you're done with the problem list, you're never gonna be 5. You're gonna be more than 5.
Oh,
Yeah, more than 5. So then like you're not gonna be saying that, oh, Dr. Nakashan, you told us 5, I write 5. No, if you have identified other problems, it has to be listed. You cannot ignore because you already asked. Is that clear? Because like a lot of the students are, we don't have 5 problems. Like you have 5 problems. There is a lot of problems. Like nobody's in perfect world, right? Okay. All right. So this much, I think like you got saturated. I think we accomplished a lot. So I'll post that. So I think other students will appreciate that too, right? So you